Okay, and as people are joining us, I'd like to let you know of some upcoming events that we have. So our next presentation for the Concept Commercialization Virtual Series is May 3rd with Michael Bird from Skylight Law, and he's going to talk about safes, convertible notes, and engaging your first lawyers. After that, we have the importance of including research sites in rural areas with Dr. Ayal Kadar, who is at the Department of Clinical and Rural Research or Health Research in St. Lawrence Health System, Potsdam. Dr. Jamas Vishvili at Upstate is going to talk about the Pathology Research Core and Digital Pathology SPORE facility that's available for research collaborations, and that's May 24th. On June 7th, we have a pitch deck business plan development presentation by Brad Banikowski, who is our regional Empire State Development representative. He's an entrepreneurship navigator. And then Trevor Cole, who's the associate director of WCG Avoca, is going to talk about right sizing SOPs, standard operating procedures. We did change the date for that session. It now is going to be June 22nd. And for those who have an interest in clinical research, we are now coordinating New York State SOCRA Chapter Summer Program. It's an all-day program. It's going to be held at the Lodge, which is at Baxter headquarters in Skaneateles Falls. If you've never been to that facility, it's a beautiful facility. And better yet, they have really, really good food. And we'll have some presenters that will be talking about bioethics, pediatric research, site selection, and a few other topics. If anyone is in medical device, we have our 16th annual Medical Device Conference that is sponsored by SOCRA, the Society of Clinical Research Associates, which I co-chair with a colleague of mine from Biotronic, Angie Rock. That's going to be in Scottsdale, Arizona on the last week of April. If anyone wants some information about that, it's not too late to register for that conference, and you can let me know. We are recording. I will be sending the recording link tomorrow. I have sent out the speaker slides. If you didn't get them, please let me know. And our speaker has requested that we save questions for the end of the presentation. So I'm very happy. Well, are we at 3 o'clock yet? So we'll wait just a couple more seconds to start at 3 o'clock in case we've got some more folks that are chiming in. Okay, 3 o'clock. So I'm very happy to have with us today Reg Harnish, CEO of OrbitalFire, and he's going to talk to us about cybersecurity lessons from the coronavirus. Reg?
Great, thank you. Appreciate the introduction, and thank you everyone for your time today. This, healthcare is one of my favorite audiences to speak to because I feel like there are, believe it or not, a lot of parallels between the way we deal with cybersecurity and the way we deal with our own personal health and fitness. I'll talk a little bit more about that, but certainly the coronavirus and the pandemic over the past few years has kind of highlighted a lot of this overlap, and instinctually how we deal with global pandemics and cybersecurity tend to be very similar, but in some important ways they diverge. And so I want to talk about those as well. I think, just generally speaking, we've done a much better job dealing with COVID-19 than we have with cybersecurity. A little bit about me. So I've been in cybersecurity for the better part of 15 years. I am involved with a number of cybersecurity companies, some building tools, and then some organizations like OrbitalFire, where our job today is protecting small healthcare organizations and other businesses. But our customers are, what we consider small, somewhere between 25 and 1,000 employees. They don't have the same requirements necessarily, or scrutiny, or risks and vulnerabilities and exposure that massive health systems and things do. And so that's really our specialty today, and I'm happy that all of you can be with us today. Let me first start by talking about what's happened. Really, it sort of came up in the pandemic, but really over the last 2 years, I've kind of seen cyber crime and cybersecurity become a household word. A lot of that had to do with the fact that it affected everyone. So we think about some of from the Colonial Pipeline incident to a meat packing plant to, a lot of these were situations where normal everyday Americans who maybe had never even heard the term before, suddenly the price of their steak tripled, or they couldn't get gas for a week, or their emergency department was closed for hours because the hospital was recovering from ransomware or some other type of issue. And so what we've seen is that cybercrime has moved out of this sort of dark, damp basement into the world of everyday. And that's really important because, again, as I mentioned, cybersecurity and the way we deal with cybercrime is much better treated as a fitness program than it is technology. Oftentimes, cybersecurity and technology get lumped together. That's not really a good organization. They're very dissimilar in a lot of ways. But let me explain a little bit what I mean. So in healthcare, I took an hour-long walk today, was just shy of 4 miles, and all I feel right now is sore. And that's because there's no direct correlation between your investment in health or personal fitness and the outcomes. Now, generally speaking, we believe that if you exercise, get sleep, drink water, have a kale salad on occasion, that's going to not only lengthen your life, but also improve the quality of it while you're alive. But that's not always the case, right? We've seen ultra marathoners have heart attacks. We've seen, fitness gurus and personal trainers, get very sick. And then we've seen people who smoke and drink every day live to 100. And so we know that there are some general principles around being healthy and living long, fruitful lives, but they don't always apply. And the exact same thing is true with cybersecurity. We've seen lots of organizations spend tons of money on cybersecurity and still have issues. And then we've seen a number of small businesses who have done nothing in cyber and have just gotten very lucky. The second thing is that, like personal fitness, it's never done. So my walk today might have some residual effects over the next 24, 48, 72, I don't know, maybe a week, hours. The same thing is true in cybersecurity. It's never done. And the protections that we put in place today may not be effective tomorrow. And we're going to need to continually assess what our threats are, whether it's ransomware, wire fraud, money missing from a payroll account. You're going to need to continually assess those things every single day, every week, every month, every year. And really, there's no finish line. And so again, like personal fitness, you don't just go for a walk once and become healthy. You have to do it every day. It's a recurring, consistent, endless process. And then the last is there's no guarantees, right? So just like you could pay for the most expensive, sophisticated and advanced, health treatments for your disease or get the best doctors and personal trainers, there's no guarantee that you're going to be healthier. Cybersecurity is very similar in the sense that you can implement all 1,000 cybersecurity controls or protections, and you may still have issues. And that's the world that we live in. It's really kept cybersecurity from being more successful than we thought it would, right? Because everyone is terrified these days. If you ask any business owner, small, big, doesn't matter where they are, what industry they're in, everyone has cybersecurity on their mind. A couple of other places where cyber and the coronavirus and the pandemic overlapped are here. One, they were both viral, right? They spread very quickly. So cybercrime has really only been around meaningfully for about a decade or so. Now, we had cyber related issues going back as far as 1969 when the internet was invented, but certainly in terms of a pandemic level situation, cybercrime really started growing up and spreading quickly, not that many years ago. It's also global, right? So the pandemic spread when humans came in contact with each other. And now with the internet, cybercrime is the same exact way, in the sense that when the internet allows connection between people, that enables cybercrime. That virus spreads exactly the same way, which is connectedness. They're both very expensive. So we don't have good numbers on the losses from cybercrime today, but we know it's billions of dollars. Even with the reporting that we do have, which is honestly not great. Most organizations prefer not to report. But just in the data that we've collected, we know that this is losses in the billions of dollars. And I don't have a current number on what the coronavirus response cost the world, but we know it's a very, very big number. And then lastly, it's life-changing. I'm sure there are others out there like me who I wear a mask on a plane now, and I wish I had been wearing a mask on a plane for the last 30 years because it's just smart. And so very similar to cybercrime, where we have changed the way we do business, the way we budget for services, the way we think about risk because of cybercrime. Both of these things have had massive, endless impact to organizations all over the planet. So a lot of commonality between the situation with coronavirus and cybercrime as it exists today. In fact, a recent study from Price Waterhouse suggests that the pandemic and the effects from the pandemic and cybersecurity are the top two concerns at the business level. So, and very close, right? So these are boardroom conversations. Every organization is thinking about both, whether it's, how do we enable a remote workforce and protect them? Are we stocking flu and other pandemic kits? What are we doing? So all of these things are really at the top of mind for most boards, businesses, executives, decision makers, and leaders. But where they start to diverge in one place is here. So this is the up-to-date reporting on COVID-19 cases. And we can see, right, obviously in March of 2020 was when the pandemic really launched or started in a material way, and then went through a lot of fluctuations, but had a number of peaks right through the end of 2022, and then it started to die down. However, cybercrime is doing this. It is continually increasing year over year. We seem to have no vaccine for it. We seem to have very little motivation to practice the types of basic fundamental protections that made our response to the coronavirus successful. Things like hand washing and wearing a mask and avoiding people, that kind of thing. We still have not figured this out. So this is one area where our response to a global pandemic was far more effective for, in some ways, unknown reasons. I'm going to talk about a number of these things and how they continue to overlap, and point out a few places where I think that they diverge. But we've been able to learn a lot. So I want to talk about a number of those things, starting with number one. So the first is, being vulnerable does not make you more likely to contract a virus, but it definitely affects the impact. Imagine an elderly person with COPD and asthma who, may be exposed. But if this elderly person was not exposed to human beings, they're essentially unlikely to contract the virus because connectedness is truly the vulnerability in itself. The very same thing is true of cybersecurity, where if we went and disconnected all computers from the internet, cybercrime would essentially cease to exist. Not completely, but the vast majority, 99% plus of all cybercrime would cease to exist. And that's because when we put human beings together, particularly over the internet, that's how cybercrime spreads, just like that's how COVID-19 spread. And so our job here now is to, because we know that we can't completely avoid human beings, we can't wear masks in every situation, and social distancing is only effective in certain practices, is understanding connectedness in itself is a vulnerability. Now, that vulnerability doesn't make you more likely to get hit or have, experience an incident or contract a virus. But if you are connected to others, you are much more likely to have a significant impact. And that can come in the cost of in dollars, time, energy, reputational damage, right? For us, our job is to measure impact for incidents and to reduce and manage that impact to a minimum level. But the connectedness of things really creates major challenges for us. The next one is that we are all living in a global village. And so while the coronavirus may have originated in China, maybe it didn't, that global community is responsible for the response. And we feel that, obviously there were widely varied opinions on the severity or importance of some of these basic precautions. But generally speaking, we knew that we would see continual connectedness of people, and those types of things were making headlines and news stories. But your supply chain in cybersecurity is exactly the same way, in the sense that there's no way to avoid working with third parties these days. I mean, everyone has moved to the cloud in some material way. Everyone is outsourcing. Everyone is buying equipment and services from places that may not be verified and much less secure. And so whether it's a medical device or it's data analysis, it could be a lot of different things. It's really important, no different than with COVID-19, to assess who are we working with? Who will we be close to? Who are we going to share things with, whether it's a conversation or EPHI? This has become really a paramount importance, because healthcare in particular, like many industries, but healthcare is particularly, I think, susceptible to this. Your business associates may not be practicing cybersecurity the way that you are. And if they are taking custody of your EPHI, if they have persistent connections to your networks, if they are involved in, satisfying, and dealing with patient care and safety, they are part of your risk. And you need to understand that aggregate risk so that you can deal with it in an effective way, right? Just like each of us made decisions about whether or not we were wearing a mask or washing our hands, the same is true for businesses with cybersecurity, that until you know who you are sitting next to or working with or sharing things with, it's difficult to assess that risk. And once you understand the risk, you're expected to make good decisions on behalf of your patients and the rest of your supply chain. Let's not forget that going back to the massive Target incident years ago, that incident was made possible and caused by a 32-employee HVAC contractor. They became the weakest link, and ultimately Target fell because they were connected to someone who was less secure than they were. And they created a major vulnerability in a global incident. You know, it was difficult to avoid crazy headlines during the pandemic. And it, like it does with many other topics, it seems like national media and the news were really flocking to these, sort of exaggerated stories, whether they were fact checked or not. And they got a lot of headlines. And in fact, you could argue that some of the divisiveness that occurred during the pandemic really came from misinformation and disinformation, which has become a plague and a pandemic in its own. The same thing is true in cybersecurity. When we talk to business owners and leaders, and executives and decision makers, they're often focused on this headline. And no matter what we say to them, and no matter how well we can separate their issues and risks from this, latest, greatest headline, oftentimes, the human brain doesn't accept that. And it's kind of stuck on hype and hysteria because a lot of cybersecurity is an emotional decision. In fact, there's actually two parts to cybersecurity. So let me just tease those apart. The first is the way we feel about security, like how secure do you feel? And this could be in your home while you're, avoiding a virus, or it could be at work while you're avoiding cybercrime. There's a lot of feeling. So the first is the way you feel about your security. The second piece is the reality. Now, sometimes they overlap, but oftentimes they diverge. A great example is 9/11 in this country. I have no idea what the age of all of you attendees is, but I remember exactly where I was when I was watching what was happening in New York City and the Pentagon and other places. And since then, the United States government has spent trillions of dollars fighting terrorism. And the question now becomes, how many of you have been directly affected by terrorism? We've spent trillions of dollars dealing with this problem. And I can guess that it's zero. None of the attendees in this webinar have ever actually dealt with terrorism themselves. Now, ask yourself, how much have we spent time, money, and energy on fighting texting while driving? Any precautions or technology that disables phones in a moving vehicle, things like that. We've done very little, and texting while driving kills, I don't know the exact statistics, but significantly more than terrorism ever will. Another great example, right? It's a beautiful day out. Everyone's thinking about summer vacation and getting out of here for a while. When you go to the beach, are you more afraid of sharks or vending machines? Well, obviously, I know the answer here. Of course, you're more afraid of sharks. But if I told you that you are 7 times as likely to be killed by a vending machine than a shark, now what are you more afraid of? Well, sadly, you're still more afraid of sharks. It does not matter. Our lizard brain and human evolution have ensured that we make some bad decisions around risk as well, despite the fact that we are, as a species, pretty good at managing risk. We've survived for hundreds of thousands of years with a similar brain structure. But when it comes to cybersecurity, we very much get distracted by hype and hysteria, very similar to what was going on in the pandemic. And so our job is to separate the feelings of cybersecurity from the reality. Truly understand your data, conduct a risk assessment, figure out what threats and what types of incidents may affect my business, what's most likely and what would be most impactful. And then from collecting all of that data, you can start to build a roadmap on what do we do to handle these cybersecurity risks and issues. Again, as most of you are stewards and custodians and protectors of patient information and patients themselves, this has become an important responsibility, is truly seeing through some of the hysteria in cybersecurity and really getting down to a risk-based decision-making process so that, one, you can maintain compliance, of course, but two, in terms of organizational and security resilience, really focus your efforts in the places where there's the most bang for the buck. Next, well, hype and hysteria, sometimes they're spot on, right? So just because the national news is, you know, magnetized and attracted to a specific exaggerated story doesn't make it not true. And so when we think about cybersecurity headlines, and years ago, the fear that a cyber attack would shut down the grid, the electrical grid, and we all sort of, kind of poo-pooed that, like it seemed impossible that, a band of hackers could take down the electrical grid in this country. But we saw it happen with Colonial Pipeline. If you remember, the ransomware issue there shut down fuel supplies to South Carolina, Georgia, Florida, and lots of other places. And what is interesting about that story is that the Colonial Pipeline ransomware attack shut down gas stations in places where Colonial Pipeline was not supplying gas. It was all hysteria, just like toilet paper during the pandemic. The demand went up, and so there was an artificial shortage that was driven by fear buying. And the supply of toilet paper never changed. Now later in the pandemic, it did, as supply chains kind of got twisted up. But in the beginning, it was nothing but hype and hysteria, and so we had to react to things that felt hysterical, like toilet paper shortages, but were truly the reality. Same thing is happening in cybersecurity, where some of these things sound so fantastic that even James Bond couldn't protect us. But some of these things are happening these days. And I don't have to tell anyone here about what's happened in healthcare over the last 5 years and the kind of impact that patients have felt because medical devices and networks and computers and mobile workstations were encrypted and unavailable, and organizations reverting to pen and paper for weeks, months. All of these situations have had an incredible effect on our ability to provide assurances around patient care and safety. It's real. I mean, this hype, this hysteria does happen. And so, again, coming back to the data and how to prove or disprove the kinds of things that we're worried about is going to be really important. Getting down to understanding your risk around EPHI, your vulnerabilities, assessing those, testing them, measuring them with a good cybersecurity program becomes more important every single day. We also know, certainly with the pandemic, and I felt like my family did a pretty good job of avoiding it for years. We did end up with I'll call it a mild case at one point, because we really weren't prepared. The one time that we decided that we weren't going to wear masks in a social gathering was the time that we all ended up contracting it. But we were prepared. Like we're healthy. We had been vaccinated. We had done a lot of things to prepare for not just avoiding the virus itself, but if we were compromised, we wanted to come out of it in the best possible way. Cybersecurity tactics align perfectly with this, because we know that the better prepared you are, primarily around your ability to respond to incidents, having an incident response plan, a trained incident response team, playbooks for ransomware, wire fraud, business email compromise, loss of a device with EPHI on it. Having those playbooks and a trained team to respond truly reduces the impact of these types of incidents. Preparation may also come in the form of knowing your FBI agent, or having a retainer for a cyber fluent attorney, or having a crisis communications plan, right? As healthcare providers, you're required to develop a business continuity plan, a disaster recovery plan, an emergency mode operations plan, right? These are all required controls in the HIPAA security rule. But the incident response plan is really sort of a part of that, which is, in the event of something bad happening, how well will we respond? How effectively can we reduce the impact in time, money, and energy on this incident. And it's really about creating resilience in your organization. I love a quote from Mike Tyson from many years ago. He said, the greatest boxers in history weren't the ones that could throw the hardest punch. They were the ones that could take the hardest punch. And we've seen that proven out in cybersecurity every single day. And so even if it's some basic precautions like vaccinations during the pandemic, these are things that have really long-lasting positive effect on our ability to survive, both as a species as well as a business. So effective preparation has become part of the vernacular in cybersecurity. We used to only focus on prevention, and now response has become really the number one topic. Now, just like in the pandemic, we used to hear about folks who thought that the pandemic was a hoax, and or that there were others who felt like masks wouldn't protect them. And, there was the conversation around, well, these are just basic things that are really easy to do. We understand that you don't want someone else telling you what to do, but washing your hands a couple times a day, like, that's pretty easy. You can do it in 60 seconds. Doesn't require any expensive materials. We have the same conversation with healthcare providers, physicians' practices, small health systems, networks, anyone in healthcare around the basics in cybersecurity today are truly where you want to focus, because they provide a significant amount of protection. So understanding your risks, conducting a risk assessment, building an incident response plan, training and testing and changing the behaviors of your workforce, right? Your clinical staff, your administrative staff need to understand that they are targeted and that they are one of the many weak links. Another one is a cyber insurance policy, right? That's just not optional anymore. But there are also basic elements. A risk assessment you can do in 3 weeks. A training, testing your people policy. Everyone understands insurance. We've been doing this for years. This is not really rocket science or brain surgery. How's that? These are sort of basic precautions that have tremendous return, and they're simple. Like, we all understand them. I'm guessing that everyone on this webinar has heard about awareness training or a HIPAA risk assessment or an incident response plan, right? You're familiar with the concepts. You have a general understanding of what they're supposed to do. These are simple protections and precautions. We call it basic hygiene, but no different than washing your hands. They are just, they're well understood, and they're simple. Now, unfortunately, some things are simple, but not easy. So, for example, a HIPAA risk assessment, you may understand exactly what it is, but you may not have the expertise to do it. There's a lot of quantification, qualification, understanding threat and vulnerability pairs, replacement costs for EPHI assets, and asset inventory. There's a lot that goes into it. So simple does not mean easy. Similarly, with an incident response plan, you want to make sure that you've identified each role and responsibility, that they've gotten role-based training, that your playbooks really get specific about whether it's IP addresses and networks or assets, and is it based on your EPHI inventory, right? So simple, but not necessarily easy. And the same with cyber insurance. We're getting a policy today, while it seems very simple, that's changed dramatically over the last 3 years. It used to be, 5 years ago, even if you wanted a cyber insurance policy, you contacted your broker, they would get an application out to you. You would just say yes, 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 yes. You'd send the application back, and you'd end up with a policy. Today, things are incredibly different. Not only have the requirements for insurance grown probably 3, 4, 5-fold, but you're now going to be required to prove that all of these things that you said yes to, multi-factor authentication, training for your people, encryption of data, you're now going to have to prove all of those things before you get a policy. You're not even going to be eligible for a policy unless you can prove these things. So simple doesn't mean easy, but oftentimes these not so easy solutions are the ones that have really the best return, right? So going back to the HIPAA risk assessment, if you want to know what to do, what order to do it in, and how much of it to do, the risk assessment answers all of those questions. Again, simple, not necessarily easy, but the return on that investment is just incredible. Not only that, it's one of the foundational elements for compliance with the HIPAA security rule. And for good reason, because your entire cybersecurity roadmap should be based on a risk assessment, right? We often hear about low-hanging fruit. And we'll just do these things because they're easy or they're cheap. And that sounds great in the conversation, but unfortunately, most low-hanging fruit has very little impact on your overall risk. And again, as a covered entity under the HIPAA security rule, we are all charged with managing that risk and showing continuous improvement over time. So simple, not easy, but high return. And you don't need to be an expert. Certainly there are providers out there, not a commercial for OrbitalFire, but that's all we do is, help small healthcare organizations, whether it's a startup or it's just a small provider, deal with all of these simple but not so easy tasks in cybersecurity. We, when we were all sort of facing this strange situation of going back out into the world, right? So when we saw COVID cases start to drop and we were all really sort of antsy and anxious to get back into the world and meet people and social gatherings and shake hands and all of that, this one thing sort of came over me, which is this idea that you could be a carrier of the virus and not know it. And so being careful yourself, it required a lot more thinking and preparation because you could be exposed and without ever knowing that. Cybersecurity and cybercrime are very similar. If you look at any of the statistics that are out there, oftentimes it's weeks, months, sometimes years where someone has compromised an organization's network or people or their patient records. And it's not until 6 months later that everyone knows because now they're seeing the ransom notice or all of their computers are shut down and encrypted, or all of that EPHI has been stolen, is now being sold on the black market, right? The dark web. And so we have to start to act, react, and prepare as healthcare providers who are ultimately responsible for the security of patient data. We need to make some assumptions about cybercrime. Unfortunately, no one is invulnerable, right? And at some point you are almost 100% likely to experience some kind of incident. And again, it could be directly related to theft, compromise, and ransom of EPHI, but it could be money missing, theft of devices, intellectual property, many other things. We have to, going forward, assume that at some point we're going to be sick, because thinking that wearing a mask and washing your hands will prevent all diseases and all viruses is that's really not smart. Similarly in cybersecurity, where we do see many more organizations today, right? This cybersecurity is really taking off and most businesses are doing more and more year over year. But there's oftentimes this false sense of security that I've got a firewall, I use antivirus or endpoint protection, and I train my people, so we should be good. Well, there's really no such thing as good. And as we've seen with, human evolution and the evolution of diseases and viruses and bacteria over the years, that they're always there, right? The potential for infection or disease or sickness is always there no matter what we do. There's no way to avoid all of it. So as we kind of started this conversation around the lack of guarantees in cybersecurity, it's really important that we are, as owners or fiduciaries or decision makers, that we are constantly vigilant about the changing threats in cybersecurity, but also the changing protections and precautions and safeguards that we can be taking to help. But let's not ever get too comfortable thinking that we're invulnerable or that we've done enough in cybersecurity, unfortunately, that we're no longer likely or vulnerable to these types of issues. We've seen the DoD constantly compromise the federal government, and really just pretty much every other organization on the planet facing these types of things. So for us, the way forward looks more like planning, preparation, doing the basics, some basic hygiene, and building a response capability so that if and when it does happen, that we've got medicine on hand, or we are effectively trained and prepared with an incident response plan, right? Again, the same types of corollaries here apply to both situations. Now, going back to, again, for me, talking to a healthcare audience is always exciting because I feel like you understand it and you get it. Let me take the example of a heart attack victim. Now, typically, folks who have heart attacks are ones that didn't prepare, right? They didn't eat enough kale or get enough sleep or enough exercise, but it's not always the case. But what we do know is that most people who have a heart attack, immediately following that heart attack, they are the poster child for healthy living, right? No salts, lots of water, daily exercise. And that type of life change can be really powerful from a health and fitness perspective. But oftentimes, honestly, all too often, we see that heart attack victim 6 months later, there's sort of once in a while, they'll reward themselves with potato chips. And then another 3 months later, they're spending more time on the couch watching TV. And then, if you fast forward 2 years, they've probably reverted to all of their bad habits because that heart attack is no longer front and center. They're not feeling the pain, the bills are paid, the physical restrictions, the emotional stress, their family, all of those things are now a past story. So our challenge, because cybersecurity is very similar, an organization who has been hit by an incident, they tend to be very heightened around spending more money on cybersecurity, better protecting patient records, building patient care and safety into their cybersecurity incident response plan. It could be anything. But part of this is a cultural challenge because this is not about eating kale for a couple of months after a heart attack. This is about changing your life. It's about changing your culture. It's about changing the way you approach these problems. Because if you revert to your bad habits from before the heart attack, the likelihood of a future heart attack goes up again increasingly. Same thing is true in cybersecurity. This is about culture and about understanding and managing risk, but this is not something you do once. Even if you experience an incident and everyone is sort of on guard and talking about how they can help and spending money on cybersecurity controls, if you don't make that a permanent change, the likelihood of experiencing another cyber attack or incident continues to go up. Again, remember that the frequency of cybercrime, we can't even calculate it at this point because one, we don't have good data, but two, it's increasing so fast that we can't even collect data fast enough to assess and analyze. Same thing with the severity and impact of these incidents. It continues to increase as well because as our adversaries become more sophisticated, they understand, well, what is a patient record truly worth on the dark web? What can I sell it for? That social security number. Or can I continuously compromise these organizations using that same data? And so while cybercrime continues to accelerate out of control, as well as the costs and losses to cybercrime, this is really about building a culture. Part of that acceleration is due to the fact that we, as a business economy and society, have made decisions that, for whatever reason, we don't treat cybercrime the same way we treat a global pandemic, even though they are very, very, very similar in nature. And that a lot of it comes down to developing a culture of security, which means, one, you identify and thoroughly communicate and train and live by what we call your risk tolerance, meaning, are you a risk averse or risk tolerant organization? Where on that spectrum do you fall? And then building those values into your culture, right? So when you're hiring, when you're evaluating your workforce, when you are creating your annual budget or building your annual report, when you are honestly making rounds with patients, are you thinking about cybersecurity? You should be, because increasingly those patients and their information are becoming ones and zeros. That data is very valuable and will continue to be valuable as long as cyber criminals are making billions of dollars, and they are today. And so really think about this in terms of cultural development and building and implementing cybersecurity and integrating it into really every aspect of your business, from accounting to clinical to administrative, finance, you name it. Cybersecurity has an impact on all of those things. And then lastly, cybercrime only exists because people on the other side of the world can make more money doing that than whatever they can make in their small farming village in the foothills of Romania, right? So these stories have been told countless times, but hacker groups or an individual who, after buying a personal computer and getting into cybercrime and hacking Americans or anyone else, 2 months later buying BMWs for every person in their family. This is all enabled, and really the root cause of cybercrime is because that individual had two choices. Either they could go bag groceries or, till carrots and potatoes at the farm in their little village, or they could buy a PC and hack Americans and buy BMWs for every person in their family. It's an economics issue. All cybercrime is opportunistic these days. Even nation state sponsored issues between China and Russia and the United States and others, most of it comes down to economics. Now, that's the problem, but the solution also comes down to economics, right? So you, as decision makers in cybersecurity, you want to know that if you spend $1 on cybersecurity, that you're going to get $2 back. And that is still very difficult today, just given the nature of the solution. Another issue is that cybersecurity and cybercrime, they're very asymmetric. And what that means is that offense is much harder than defense. Very similar to why we never see, or we rarely see, 0-0 ties in sporting events, is that scoring is much harder than preventing scoring. And our adversaries know all of this, of course. And so our job now is to figure out, how do we make the best economics out of cybersecurity? Well, I can tell you that in many industries, including healthcare, having a good cybersecurity program has become a competitive advantage. And we know that healthcare is hyper competitive, whether it's through acquisitions or it could be a lot of different things. And so thinking about cybersecurity as an asset is really important, because not only is it a competitive advantage, it can help you reduce or avoid costs. It can protect your reputation. All of these things translate into dollars and cents for the organization. So keep in mind that this is no longer a cost center, but you have to be thinking critically about cybersecurity, meaning you can't just go, read an article or a headline, or you look at what the hospital down the road is doing for cybersecurity and just copy and paste. This is about truly understanding your risks, your organization, your data architecture and footprint. What is your supply chain, your business associates? What does that look like? And putting all these things together and making informed decisions about, where do I invest in cybersecurity? Some things are going to have others. And there's a process for this, a risk assessment. Honestly, at the core of your program, you do these on a regular basis. They can have just, incalculable positive effect on your ability to move cybersecurity from a cost center into a revenue generating, or certainly a cost saving asset and a competitive advantage. Again, no one wants to visit the emergency room that just got hit with ransomware, or the physician's practice who lost all of their patients' data. And now those patients are, getting phished or social engineered. So there's a lot going on. The society in general now understands cybersecurity at a much deeper level. It's a household word, and you can thank the last 2 to 5 years for that. So everyone knows about getting Twitter jacked, or not being able to go to their local fast food restaurant because it's shut down, or businesses not surviving incidents. It's all happening. But if you think about this at an economic level, you can start to make better and more informed decisions and measure your return on these cybersecurity investments. Truly, an evolutionary step, but one that could not be more important. So we come full circle back to this idea and this reality that cybersecurity has become a household word. All of you are familiar with it. It's why you're here today. You may not be experts, but you understand, and you've seen the negative impact. You understand that there are requirements of you, whether they are legal, regulatory, contractual, or otherwise. You know that it's out there. The step now to take is to truly understand what your risks are, not someone else's, but your business's risk. Build a program. Don't bite off more than you can chew. Start with the basics, basic hygiene, some of the things that we consider simple, even if they're not easy, that have massive return. And then year over year, demonstrate and prove continuous improvement. That is the name of the game in healthcare, manufacturing, financial services, you name it. Every industry is struggling with the same types of issues, in that cyber is never done. It can be expensive if not done well. There are no guarantees, etc. All of these things are making decision-making harder, but you have some tools at your disposal that you can leverage to make much better decisions, so that, one, you're in a much more defensible position. By that, I mean, if someone asks you about your cybersecurity program and you tell them, well, they better shake their head yes and say, okay, that seems reasonable and appropriate. We'll work with you, or we won't penalize you, or etc. But then the other half of this is resilience, right? None of us wants to be out of business, or probably more commonly, disrupted by cybercrime. It's not good for business, no matter who you are, no matter what size organization you run. Having your computers disabled and encrypted, unavailable, that's not good for anyone. So that kind of resilience is also important, and the ability to get back to normal business operations has become really one of the primary goals of a cybersecurity program. So defensibility and resilience, the two most important goals of a cybersecurity program. You have tools at your disposal to achieve most of this, if not all. And hopefully someday we get to change the economics of cybercrime such that it's way more expensive to attack an organization than what you're going to get out of it. Because as soon as our adversaries can make more money doing something else with smaller investment, that's what they'll do. So if they may end up selling yachts in Dubai, or they're going to move on to something else. But we've got to start to think about the economics, the risk, the basic hygiene, culture, and putting all of these things together so that as a society, as an industry, as an economy, we can start to better survive and withstand and the likelihood and impact of these types of issues. That's my story, and I'm sticking to it. If there are questions, I think, Kathy, we can throw them in the chat or the Q&A if that's available, but we'll take any questions, whether it was on this content or anything in cybersecurity, healthcare, HIPAA security rule, you name it. We're here to answer your questions.
Great, thank you. That was wonderful. Does anybody have a question they'd like to unmute, or you're welcome to ask a question in chat?
You know, one of the questions, I'll start just to kind of prime the pump here. One of the questions we often get from healthcare organizations is enforcement around the HIPAA security rule. And so, you know, HIPAA's been around for decades now. It's getting pretty long in the teeth. And most healthcare covered entities have never experienced any true oversight or enforcement from HHS, CMS, OCR, you name it. And I would agree with that. I think, you know, the federal government sort of put this out there hoping everyone would comply, but never really, you know, thought about how they would enforce and provide assurances around compliance. But what we're seeing in healthcare, like in other industries, is that our customers care way less about the federal government than they care about their next potential customer or business associate or supply chain partner, because those are immediate and very close to the business. And so, for example, you know, if you become a business associate of a covered entity, you are effectively required to comply with the HIPAA security rule, just like a covered entity these days. And you're much more likely to face scrutiny and enforcement from your customer or your upstream partner than you are the federal government. So contracts and business associate agreements are becoming, those are the vehicles. That's what our customers, that's why they came to us, is because doing normal daily business was affected. They weren't so worried about the federal government. They were worried about someone else enforcing compliance and asking about their cybersecurity program. Another place is cyber insurance. Again, I talked a little bit about this, but those applications are becoming invasive and very intense. And so, you know, if you are in any way required to or decide to, you know, purchase some kind of insurance vehicle, the chances that you'll be able to do that without some kind of compliance program and cybersecurity program are basically zero today. So we often get questions about insurance. We get questions about enforcement. And then, you know, there are things, of course, we get questions about what we do. We'll hold that for later. And if anyone wants to contact us, you can, here's my email address. But, you know, this is really about making and taking the first step, and then, you know, building that fitness program over time. I mean, you don't just go out and run a marathon, you know, just like you don't just go out and build a cybersecurity program. This is something you build up to.
Yeah, I was going to ask, are you seeing more and more in contracts language regarding cybersecurity protections that people have in place?
We are seeing two things. One, certainly in business associate agreements, cyber language that is increasing the requirements for working together. So if you want that next customer, or if you have an important supply chain partner, you're likely to face a lot of cybersecurity scrutiny from them. What was the first part of the question?
I just wondered if you had seen expanded use in contracts to protect, and who's liable and what that liability includes.
Right. Well, one thing is important. You can outsource your entire cybersecurity program. Effectively, that's what OrbitalFire does. For our customers, we are their cybersecurity team. But what you can't outsource is accountability.
Mhm.
So let's say you are using an EMR, could be any of the EMRs out there, or you're using Office 365 and you're putting patient information in OneDrive or SharePoint. If Microsoft or your EHR vendor are compromised and all of your patient data is stolen, you can probably sue Microsoft, you can probably sue your EHR vendor, but it's your problem. You cannot outsource that accountability. Your patients, you're responsible to them, or your customer data.
Mhm.
So that's often a misperception about, using the cloud or outsourcing. There's no way to outsource accountability. It's always your problem.
And
See a
Loretta,
question. Yep, go ahead.
yep, go ahead. You can respond to the question.
Sure. So, hi, Loretta. How does a company know that they have done enough to protect themselves? Well, that comes from a couple of places. One is, as an organization, you define a risk tolerance level, and you manage your risks down to, you continue to invest in cybersecurity until you have managed your cyber risks to what we call an acceptable level. Now, often that's not an actual number or a percentage of a budget, things like that. But generally, there are some downstream indicators, right? So if we see a reduction in incidents, if we see an increase in employee compliance with training and performance on testing, if we're seeing fewer vulnerabilities, the list goes on. There are many, many metrics in cybersecurity that, if you have a general sense of how secure you want to be, and that's kind of the magic, you can measure your program to see how close you're getting to that. But having done enough, that is also a moving target that's changing year over year. I would say 10 years ago, a covered entity didn't really need to do anything in HIPAA because no one was asking about it. Like, you weren't being forced to do that. And cybercrime was, a drop in the bucket compared to what it is today. So that's a tricky question. But I would say one important thing, don't make cybersecurity part of your IT budget. IT and cybersecurity have very little to do with each other. Next, from Gabriel, how do you see AI impacting cybersecurity? Well, it can't come fast enough because as an industry, we are almost purely reactive because there's so much noise. There's so much activity going on. And whether that's an audit or regulatory oversight or an incident, like, we are so busy and we do not have the talent in the workforce to handle all of this. We need computers to do more of the, non-value add stuff in cybersecurity, like updating a firewall rule or reissuing a training or something like that. But today, I would argue there's just not a lot of progression in AI or even like machine learning. I mean, some tools have it. We've seen it in places, but it's not something that the industry has adopted and implemented widely.
Opportunity for innovation.
Opportunity for innovation. Sergio says, often cyber training comes with lots of technical terminology. Yeah. Is there any effort being made to provide workforce cyber training in plain language? When we started OrbitalFire, that was one of the values that we've sort of built everything on, because we believe that people would do more in cybersecurity if they just understood it. If you are evaluating cybersecurity services or tools or technologies, and your provider can't translate what it's going to do into plain English, time to look for a different provider. Same thing with training. We often blame end users. The industry loves to call end users the weakest link. They're not. But oftentimes it's because the training is terrible, because it's like an hour and 45 minutes long and I can't fit that into my day. Or like you say, Sergio, it's just filled with jargon and stuff that, why do I have to understand encryption? That's not the kind of training that's relevant to me. So role-based training that's short and relevant to that individual, that organization, is really important. But you're right, it's hard to find. There are solutions out there that work and do a much better job of training, making training even entertaining at times, whether it's animations or Hollywood level production. Those things are becoming more available. And if you have questions, we'd love to talk to you about what we're doing.
Great. Well, thank you very much. We're going to end there. And folks who have questions, you've got Reg's email address. Again, if you did not get his slides, let me know. I'll send the slides. And I will send out the recording link to everyone tomorrow. And Darian, I would ask that you go ahead and ask your question to Reg separate as we're past our time. Reg, thank you so very much. Really appreciate a fantastic presentation.
Thank you, everyone. Appreciate the invitation and hope to be back soon.
Great. Thank you.
Thanks, Kathy. Okay, bye-bye.
Bye-bye.